We led the implementation of a paid family leave policy for city employees, the first of its kind in the Midwest and the third nationally. And also with us today is Heather Whaling. She's the founder and president of Gebben Communications. An avid Twitter user, Heather can trace the majority of Gebben's business back to relationships that began online. And this ability to turn social networking into business outcome illustrates Gebben's contemporary approach to traditional and digital PR. She was selected as one of Columbia's first 40 under 40, and she was the EY Entrepreneur of the Year in 2016. So, notes about dialogue. I'd also like to welcome our Facebook online community. So, with dialogue, rules: 1, recognize a person's right to advocate ideas that are different from your own. Show respect for others and be civil. Agree to listen, respectfully hear and listen to differing points of view. Recognize that people can disagree and agree to disagree, and make sure as many people as possible have the opportunity to have their voice heard. So, thank you again for following those ground rules and being with us today. So, we're here to talk about paid family leave. At Gebben Communications, Heather has implemented the Gebben Loves Family Policy, which provides up to 10 weeks paid leave for moms and dads alike, whether they have a child through birth or adoption. And she has created a campaign to #rewrite the rules, giving business owners the tools to write rules. At the City of Columbus, Councilmember Brown worked to implement the comprehensive paid family leave benefit, which consists of 2 parts: parental leave that provides up to 6 weeks of leave for welcoming a new child, and a pilot caregiver leave program, which grants up to 4 weeks of leave to care for a seriously ill family member. Both will be reimbursed at 70% of pay. So, a little bit of background. The share of workers across the country who have access to paid family leave has been growing in the past decade, but most still are not covered. 14% of workers in both the private and public sector have had access to paid family leave in 2016, which is up from about 8% in 2006. According to Innovation Ohio, rates of infant mortality, immunization, and breastfeeding have all been seen to improve when women have access to paid leave during pregnancy and after childbirth. Statistics from AARP indicate 1.4 million Ohioans are caring for an aging loved one, and due to an increasingly older population, more and more American workers will assume this responsibility in the future. So, I personally have had to deal with these, and so I'd like to start with you, Elizabeth. You want to talk a little bit about the
Yeah, absolutely. Journey and advocacy for paid family leave started when I ran for office. And found out that my employer didn't have a full paid family leave program. I was a member of a union at the time, CWA Local 4502, and I found myself really incredulous and really wanting to point the finger at somebody who was calling down the job, ignoring my rights, etc. Right? So I went to my employer, I went to my union, I said, why are we so behind? Looked into it more and actually found that we weren't at all behind the times. We were very much status quo. As Shadia said, about 14% of American workers have access to paid family leave. What is current law of the land, so the U.S. is one of 2 countries in the nation that doesn't have some form of legally protected, guaranteed paid time off for new mothers, and one of dwindling few nations, and I think the only developed nation that doesn't have some form for new fathers as well, or one of few developed nations that doesn't. So what we do have is the Family Medical Leave Act. I think that some people might remember when that was passed. It'll be 25 years ago that Bill Clinton signed it, coming up on February. Some people remember when that was passed and sort of mistakenly maybe in their brains, if they haven't had to deal with it yet in their lives, think that that's our version of paid family leave. Well, it's job protection, but it's zero pay at all. And when you dig into those statistics about has access in our country, yes, 14% of workers have access, which is abysmally low, but among low-wage workers, only 4% have access. And if you're a low-wage worker, you really can't afford to take unpaid even though possibly job-protected leave. FMLA really only covers about 60% of the American workforce anyway because of contract loopholes written in the law, right? So contract work doesn't apply, small businesses don't apply, you have to be on the job a year, and that just simply doesn't cover most people in this economy today. So the law is desperately in need of updating, and it shouldn't have surprised me just about 3 years ago that in my first pregnancy that I was dealing with this, and so I kind of got some information and went to my union, and they said, well, we'd be willing to bring this to the table to bargain for, based on where our membership is, but we need more facts. So we partnered with a local think tank in town, which Shadia cited, Innovation Ohio, and they put together a report on the state of paid family leave. I do want to call on Erin Ryan because she's here. She was part of putting that report together, and she does great work with Women's Public Policy Network and Innovation Ohio. In the other part of my life, I do also work for Women's Public Policy Network, so she's also a colleague of mine and is very smart and knows what she's talking about, and you can correct me if I get any of this wrong. So essentially, what that helped lead to in the state of Ohio was some public entities. I think some of the sort of organizing work and publicity work we did with that report helped some public entities eventually pass policies. Fast forward, I ran for office, got elected to city council, and the program that we put together, when you're a politician, you always end up bragging about yourself, and I apologize for that. It's really not me. It was a bunch of people that put this together, but the policy that we did pass includes, importantly, caregiving leave. And Shadia cited the 1.4 million Ohioans, that's not 1.4 million Americans, 1.4 million Ohioans who are currently today caring for a sick or aging loved one. I think we do talk a lot about the burden of and the plight of America's working mothers, and we don't do enough about it yet, but it is in the dialogue right now. What we often don't talk about is America's working daughters. Caregiving responsibilities disproportionately fall to women, whether or not it's caring for a new child or caring for a sick parent or an aging parent. And because of those caregiving duties, women lose on average $300,000 in lifetime earnings. $300,000 per woman on average. And those gaps, of course, increase with women of color and so forth. So this is a problem because no single woman can succeed as well if her earning potential is compromised. But it's really also an economic issue. If we don't, I believe, if we don't as a state really come to terms with all of the caregiving needs, that is just a reality in our society, we're really losing economic output. We're losing time that women are at work. We're losing spending power into our economy. And so I believe it's urgent to fix. The program we put together at the City of Columbus also makes sure that, there was disability leave for birth mothers before, but that left out of the conversation fathers, adoptive parents, so a whole host of the ways that families are set up. And now I do think we have something that's a lot closer to helping families. So there has been some momentum on the public side. We were the third public entity in the country to put this kind of policy in place that included caregiving leave. There are a couple dozen or more that have done parental leave, and a few states have passed full state policies that provide the benefit to anybody who lives in that state. The City of Columbus, we employ 8,500 people. We're the 10th largest employer in the region, so we're affecting a lot of families, with this policy. But of course, we know that more people need it, and it really takes states to lead. California implemented theirs almost 15 years ago. Some states have followed, and we're learning more and more about what the right laws in place look like and how they play out for families. But an important piece of the puzzle right now, and which is why I think both Heather and I are here, is that employers come in all shapes and sizes, and having private sector leaders be a part of this movement, if you will, be a part of enacting these changes is the only real way that we're going to have, parity among American workers, whether you work an office job or punch a clock. And that's absolutely critical to healthy families and critical to closing the wealth gap and the poverty gap. I mean, again, going back to the 4% of low-wage workers that have access, and connecting the dots with some of the other stats that Shadia cited, if we talk about the infant mortality rate that's too high across the country and in our state and in our city, and yet there aren't these social supports for women to actually navigate that process, and immunization rates go down, and pediatric visits are rarer when women don't actually have the time. I was shocked when I had my first child at how much she needed to go to the doctor. As a baby, I mean, first of all, she got sick, but just baby visits, right? And they're all critically important to keeping your child healthy. So we need to make sure that if we expect people, to grow up to be productive members of our economy, we need to actually give families tools to allow that to happen. So it's a public and private conversation, and I'm so glad that Heather's in our community leading the way that she is at her business. And when I don't have someone like Heather sitting next to me, I try to summarize the business case for paid family leave, but I don't have to do that because Heather can do it perfectly. So I'll turn it over to you.
Great, thanks. So to share how I got to this point, I have a 4.5-year-old son, and when he was born 5 weeks early. We were on the highway. We were, where Lodi is, so between here and Cleveland. I went into labor 5 weeks early. My water never broke. I didn't have any contractions. We were in Cleveland, and I just didn't feel good. Thought maybe we should go home. So we're driving home. By the time we got to Lodi, 2 minutes apart, I was like, oh my gosh, we're never going to make it back to Columbus. So pulled off the highway, found the closest hospital, and in Lodi, there was a sign that said, horse and buggy this way, cars this way. So it was a very rural hospital. I had my regular doctor's visit that week, and I knew my son was breech section. They didn't have a hospital. They didn't have anything that we actually needed. And so to a hospital about 2 hours away from here, so I didn't even deliver in Columbus. When we were life flighted, then he spent the first 13 days here, and I never during that point had to wonder if I would have a job to go back to or if I would get paid in the office. Of course I would have a job, and of course I would get paid my company. The statistics people, that in my life, childbirth and and I couldn't imagine type of situation, and also having to worry about the financial burden that comes when you don't have access to paid leave, or worrying about whether you're going to have a job to go back to. So that really helped for me crystallize just how important paid leave is for employers or for employees. So then at that time, my company was only 4 people. I was baby, and so it was company couldn't just wing it anymore. We needed some actual policies, the first of which being some sort of leave policy for people having children. Research, there's just small businesses providing paid leave. So my company then, as we put the leave policy in place, we were probably 8-ish people. We're at 22 people now, but we're still, that's a small business. And so you can find information about Facebook and Netflix and Etsy and all these Silicon these amazing leave policies, but that's just not reality for most employers in the country. So there wasn't a whole lot to go off of as I was putting our policies together. We ended up landing on 10 weeks of paid leave for all new moms and new dads at 100% of their salary, plus a 2-week transition period. So when I had my son, I took 4 weeks off, but I remember that transition back to work was so hard, to go from every day and not having to worry about a sitter, and then that transition back into the office and having to use every day
and not get to just be home with him. That part for me was really, really hard. And policy came together that we also provided that space for new moms and new dads to transition back into the workforce. You can't and show up their best self in the office. So 10 weeks plus a 2-week transition period. After we shared it, and asking a bunch of questions about it. It happened to be around the same time that the city was doing. And so from a timing standpoint, it just worked out really great. We were getting questions all the time. I think because of what the city had done, it raised awareness about the need for policies across the board. And we were among the early ones to have such a full policy, and especially among small businesses. So we were getting questions all the time about how we put our policy together, how are we paying for the policy, what happens when someone takes that kind of leave, how do you know they're going to come back to the workforce? And so I realized that one of the barriers, I think, for a lot of small companies is they just don't know where to start. And a lot of times 20-person companies, they don't have an attorney on retainer who can just figure these things out for them. So we created rewritetherules.co, which is a crowdsourced database of paid leave policies. And go in there and put in their paid leave policy, and then you can go in and company or length of leave. So if you're a small business thinking about putting together a leave policy and you just need some verbiage to help you get started, we created basically a free resource that makes that available. And that has been really helpful. And we have everything from, I think the city's policy is in it, which is great. Crosschecks, which is like a local startup, is in it. Zillow has their policy, like small to big types of policies. So that resource, I think, has been really helpful. We get asked a lot, the business case for it, it helped in ways that I didn't even appreciate, I think, before we started the policy. It has been really helpful from a talent recruitment standpoint. So I assumed it would be helpful from a retention standpoint. It has also opened up doors and conversations for us from a recruitment standpoint. People want to work at a company that aligns their financial interests and their values. So I can talk a lot about women in the workforce or family values, but it's a different thing for me to put my money where my mouth is and provide 10 weeks of paid leave. And when people are looking for jobs, especially when you're trying to recruit top talent and they have lots of different options, having a policy in place like that makes you a more attractive employer. I think it creates a competitive edge for small businesses especially. So it takes large companies a really, really long time to change their policy and put a policy in place like that. For me, I was able to do it in my process. I did some research and said, hey, we have a new policy. That, it's opportunity for small businesses where you could be out front right now, and it's hard sometimes when we're recruiting against some of the bigger companies in town, and this is something we can use that gives us an edge. So it's been great from a recruitment standpoint. From a retention standpoint, it's made a huge difference. I've had 3 women use the policy thus far, and all 3 of them have come back and expressed significant amount of loyalty and talked to, especially for the 2 of the 3 had children elsewhere, so they had seen other versions or lack thereof of policies, and they have talked about how it's made a huge difference for them and how it helped them transition and get acclimated and help them come back a better employee and help them feel like they're balancing it better. So I think from a loyalty standpoint, it's great. It makes sense from a recruitment standpoint. And the math isn't as bad as people make it out to be. I think a lot of times people will talk about small businesses not being able to afford to provide paid leave. You have to plan, you have to be organized. I think you probably ought to be doing that if you're a good small business owner anyway. But if you think about what a person's salary is, you're talking about a 10-week period or a 6-week or 8-week, whatever that price is, whatever that period is that you're talking about. A lot of times that person's work can be shifted over to other people for a short period of time, or maybe you bring in part-time help or a freelancer or something to cover some of the work, but it's not like you're hiring a full-time person to replace that person and doubling the salary. And if you think about the cost it takes to recruit a new person, train that person, what if, heaven forbid, the new mom came back and she was sleep deprived and made a huge mistake on the job? That could be very costly. So the numbers from the math standpoint, it is good for families and it's good for business. It makes sense on both sides of it.
So is that how it worked with you? You just decided a new policy and it went over really well.
It was a lot more complicated in the public sector. And with 8,500 workers, we all talk about the bureaucracy of government. It's really just the bureaucracy of large institutions. I mean, it's complicated to pass something, to implement something at OSU or to implement it at Cardinal Health or fill in the blank for a large employer. So we did a lot of time on cost projections. Projecting the parental leave side was actually not that hard, because whether you're a new mom or a new dad, whether you're adopting or giving birth to a child, you are probably going to add your newborn to your insurance, right? And we see that. We can look back at years of data on about how many newborns are added. And we have, I'm not going to remember the number, but our birth rate within the 8,500 people who work for the city of Columbus is about the same as the population, pretty reflective. There are more dads because police and fire are such a big portion of our payroll. And police and fire are heavily male professions. So most of those people who now take this benefit actually are dads. And we worked with, the harder part was projecting the caregiver leave. And that's why that's a 2-year pilot instead of just a full long-term benefit. Another challenge to it is that we have 5 collective bargaining units within the city of Columbus, 5 unions, and we had to open up those contracts and negotiate this benefit within a memorandum of understanding and pass those through council. And I don't know if any of you have ever worked within the collective bargaining process, but city council is a weird third entity, right? We're not exactly management and we're not labor. So, to go to the management side and say hey, I want you to open up those contracts that are really hard for you to negotiate, to go to the labor side and say, hey, we're going to open up these contracts. Don't ask for anything else. We're just going to do this one little, I think some people wanted to look at me like I had 5 heads, but it really came down to I had to be a personal advocate and really nice along the way and just get people to go for it with me. And it really helped that along that process, when Mayor Ginther came into office, his wife, Shannon Ginther, established the Columbus Women's Commission and had their goals are all around economic security for women. And so it was kind of the confluence of things. I'm a commissioner, and actually Heather is one of our newest commissioners too. And so this confluence of focus on women's issues, I think, was helpful to massaging that conversation and making it slightly less complicated than it needed to be. And I do want to recognize we also have here Shelley Biding and Aaron Beck. Shelley is Executive Director of Columbus Women's Commission, and Aaron Beck does a ton of work as a policy advisor for the mayor. So.
I think one of the important things that Liz talked about is that dads are the ones who are taking the leave. And so I think if you think about what do workplace dynamics look like now, we've got more moms than ever probably in the workforce. And for as much as we talk about mom and women's careers being important, that only works if they feel like they're valued in the workplace. And it becomes a lot easier if they have a supportive partner at home. And I think if you can start from the get-go having dads be as involved in caregiving as moms, it says in a really meaningful way that you value mom's career as much as you value dad's career. And so I think for as much as we talk about wanting to empower women and get women opportunities in the workforce, and we don't want women to be mommy tracked and all those things we hear about, that has to involve then providing paid leave for dads and making it acceptable for dads to take it. So not shaming dads for taking leave, but really encouraging new dads to take that leave as well. That helps the dads. There's tons of research about how it helps the baby. It also helps the moms.
And like I said, we are going to have a dialogue, so think about your questions and start getting them ready. We're going to open up in a few seconds. I did have a quick question. So have you guys heard feedback from larger businesses on whether they think that this is feasible and how it would affect their bottom line in terms of cost and either job sharing or training, or how does that affect if you're looking at a much larger business where they don't necessarily have that flexibility?
So you can love them or hate them, but Walmart made a really big deal last week or 2 weeks ago when they started providing paid parental leave. And there may have been other PR reasons that they did it, which is a whole different conversation. But if you are a large company like a Walmart and you can take a big step forward like that, and then you have small companies like mine and we can take that step forward, I think it showcases that companies of all size can figure out something like this. It certainly is much more complicated for a larger company in a lot of different ways, but I think you're starting to see larger companies now offering that type of policy. So I don't know the math and what that looks like at a Walmart or a Cardinal Health or some of these larger institutions, but it leads me to believe that it can be done.
Do you see with some of the larger companies that it is trickling down to some of those populations that would not otherwise have been affected? So some of the smaller wage workers, that 4%, I think you said?
4%
that,
of it.
Yeah.
So, I mean, Walmart was a unique announcement because they do employ low-wage workers. And, you know, I don't want to cite the exact companies because I don't want to smear anyone due to bad memory, but a lot of the announcements for these large companies, Silicon Valley companies, you know, like let's say Netflix, but again, just for sake of example, they will implement this for their office employees, but they won't provide the benefit for warehouse employees. And so it's still not nearly good enough. And that is really where it breaks down. Companies, typically, if you're looking at if their bottom line is their motivation, which typically that's the motivation for a large company, they look at it as talent retention and attraction purely. And I don't know that they value shift workers in the same way because they might see that anyone can fill a shift, right? Whereas office workers, they feel are a different competitive talent pool. And that's really one of the reasons why a national standard or a state standard needs to be implemented, is because every family deserves access. That shouldn't matter where you work, as to whether your child and you get this very important foundation-setting benefit. It doesn't happen very many times in a person's life, you know. I mean, you think about that, like, so my husband we didn't have a good experience with this paternity leave at his first company, or the company in our first child, and I'm pregnant again, and his company now doesn't have a set paternity leave policy, and you know he's going to work something out. And I'm talking a little too personally here now, please forgive me, but you know I think he feels like a little bit sheepish about going in, and I'm like, Norma Ray, like get on that table, say what you want, organize your people, right? And he's like, chill. I'm going to talk to my supervisor. I'm going to see what we can do. And you know, so because of that, I think that I actually forget where I was going with that, but it shouldn't matter what company you're working at. Oh, that's where I was going. So one thing I keep telling him is, I mean, you're not asking for 6 extra weeks of vacation every year, right? Like this is one time, a huge thing. Your child is born once. Your child is born once. And they're 1 week old and 2 weeks old and 3 weeks old once. And it's that trade-off for you and for your company is just a no-brainer when you put it in those terms. But if companies are the size where their employees are simply numbers on a spreadsheet, I think it's harder to do. It's a very long answer to your question, but we're not seeing the kind of progress we need to for low-wage workers, is the short answer.
Thoughts? Questions? Dialogue?
So, I'm just wondering, so we have like one representative of a private business here, one representative of the government. I'm a little bit confused as to, you know, to enact this change, what aspect of the policy needs to come from private organizations and what aspect can or should come from the government, and how can each side encourage the other to help create this change?
That is a great question, because I think it gets to the root of the issue here, which is that absent action on a larger level, employers are having to fashion their own solutions, which again continue to leave out usually low-wage workers. Plenty of other, I mean, of the white-collar workforce, I think 25, maybe 30% have access. It was 25 in 2013, so that's probably crept up because that's where most of the gates have been. But it's incumbent upon people like Heather to create this policy, in part because there has not been action to really create a program that everyone can rely on. So I mentioned that some states have done this. So New York passed a comprehensive policy recently. I believe it's California, New York, Rhode Island, Washington, those 4, right? That have policies. So those are the states that have done it. There is a bill that has been introduced in the Ohio General Assembly that has gone nowhere. And I do think it boils down to partisan control. And the bill, in order to, there's a lot of complications in sort of how this plays out through the system, but essentially the program would live at Ohio JFS. And would be something that every worker can pay into and every worker can access. And it's a minimal cost. We can't know the real cost until the bill gets some action in committee, because you have to have an allocation of dollars to actually do the actuarial study. So we have some limitations on how we know this would happen for Ohio. California's law that has passed 15 years ago is kind of our best example of the shifts that it creates for a workforce. There are plenty of California companies that offer their own benefit. A state benefit, or really we need a national standard, would not be as generous as Heather's. And Heather would, I'm not going to speak for you, but would probably continue to have her benefit. But the difference is that if there were a contract worker, that they worked with every once in a while, or she could possibly offset some costs with what the federal or state government enabled. That's where businesses could sort of see some money. And also it wouldn't matter if you switch jobs, if you, in an increasingly gig economy, we're more and more likely to see people not have one workplace where they really live at. So to answer your question in the most succinct way, the real solution has to come from a national standard or at least a state standard. We as employers have to act, because that hasn't happened yet.
In the absence of leadership at the state and national level, the onus is falling on small business owners, or on business owners in general. Entrepreneurs and small business owners in a lot of ways are on the forefront of innovation, so there's an opportunity for them to be on the forefront of innovation here, but it's a crapshoot. So if you have access to paid leave, it's just luck of the draw. Like, do you have a nice boss who has figured out how to do this or not? And it's something that's too important to be left up to luck of the draw. As a business owner, I wish there was some sort of funded statewide policy, because it is expensive. For me, it's worth it because I value my employees and I want them to have that experience with their new child. But certainly as a business owner, I would also like a way to offset at least some of the cost. So even if the statewide policy was something like 6 weeks or 4 weeks and part of that was paid, I would still do our 10-week policy, but it would help offset some of the cost. So it makes it that much more accessible for businesses like mine, where right now we're just funding the whole thing ourselves. Like, I'm just paying for it because I think it's the right thing to do. It would be great on many levels if there was funding that was available to help offset some of that cost.
And typically what those programs look like is they'll reimburse like up to, I think California's is up to 50% of your salary, but they cap it at a couple $1,000s a month. So, if you're making $1.5 million a year, you're not going to get that equal reimbursement from the state. They kind of cap it as a way to make it fair for others, but as a way to make sure low-wage families, low-wage earners really do have a choice to make about whether, I can afford to take paid time off. That's a huge thing to be able to say. I can afford to do this, and therefore I can either choose to or not.
Thank you both for your leadership, both in your professional lives as well as being commissioners here in the city. So the past couple of years, there's more companies who are going this route of paid family leave. And we've seen a couple examples where there's a 2-year pilot. Is there any, concern is the right word, at the end of the 2 years, is there going to be a look at the financial bottom line cost? Or do you think companies are building in this metrics around, what was the, hiring benefit to this and the retention of talent and the loyalty of employees? Or is there any fear that it's just going to be a bottom line number and then it goes away?
hope they're building in. I don't know how the city's pilot program is set up. I hope they're building in those metrics. I think that companies will be surprised to see it's not as cost prohibitive as they think it was. I think there's a lot of hyperbole out there right now about how cost prohibitive it is or how expensive it is. And I think once you get into it and you actually are looking at the numbers and you realize that if somebody's making $50,000 and you're providing 6 weeks of leave, that's not that much money that you're losing on it or that you're investing in a person. So I hope that they're looking at some of those other metrics, but I think the cost part of it, they'll realize there's a cost-benefit ratio. There is a benefit that also matters, hopefully.
And I do think it's hard to take a benefit away, like in general, just in the world, whether it's a government service or an employer benefit or whatever, it's hard to take it away once it's there. So that is a positive indicator, but the problem is if you just look at a spreadsheet, you're only going to be looking at costs, and you really need to, so the way that we intend to really evaluate our pilot is through actual interviews with employees too, so to talk to the people who took the benefit and to talk about how it worked for them and what it means to them to have it. And frankly, if there were things about it that didn't work. I mean, the way that it's set up, I can think of 5 things that maybe didn't actually work for someone that well. And if we hear that, then we know that there are ways we can tweak it. Or if we don't, then I was wrong. But we had to start with something.
Absent any government mandate or anything like that, what role do you think the unions or the lack thereof have to do with possibly instituting a program like this?
So since I was a union member when I first started working on this, as I said, I was I was apoplectic. I was about, not having, that this policy wasn't in place. And, realistically, when you're at the bargaining table, there are a lot of things that you're trying to advocate for your members. And you have to, as elected leadership, unions have an election process. And you are elected to represent them, much as government officials are elected to do the same. And you have to be responsive to what your membership is asking for. So one of the problems with paid family leave is your ready-made advocates, right? Your ready-made folks who want to clamor to make sure there's this change are inherently dealing with a lot of life changes, right? Pregnant women or partners of pregnant women, and pretty stressed and pretty time limited. So what I came obviously to understand is my union, when they go to the bargaining table every year, had 5 or 6 or 7 things that their membership was constantly telling them they really wanted to be communicated at the bargaining table. And then on the other side of the table, management had a lot of things that they were asking for from the union, usually financial. And so when you try to mesh those things together, not every benefit can actually make it into the discussion. And that is why I thought it was really important to do this as simply standalone MOUs and to not inject it into the collective bargaining process, because I didn't want, frankly, management to extract anything for it. I didn't think they should. Not every case is there is there going to be somebody who can, I didn't dictate, but that was just what I pushed for, right? There's not somebody who can push for that in every case. So that's the hard reality answer. I do think from a strategic standpoint, from somebody who very much supports collective bargaining rights, and I believe, and I think it's fairly provable that unions had a lot to do with building the middle class in this country, and the decreasing rates of unionization have also increased have correlated with the increase in the wealth gap and sort of the hollowing out of the middle class. So I believe unions are important, and I also believe that from a strategic place, they should probably start to uniformly push for this themselves. They know that it's right. One of the units in the city of Columbus was very excited to see that their international union, so AFSCME International, actually put into their platform at their international convening that they believe in the right to access to paid family leave, and that was kind of coinciding with when we were going through our process. So there is a place for unions to do more. I feel like I'm giving very long-winded answers to everyone's questions. I hope that answers your question.
Do you think that the reason that paid parental leave has been slow to get implemented is due more to like active opposition and saying that it costs too much, or just due to people not really knowing about the issue?
It's probably a little bit of both. So I think that we need more women in leadership roles. Sometimes it takes a pregnant woman to say, hey, there's no leave here. How are we going to fix that? So I think if you have more women in leadership roles, women, I think, are going to be more likely to advocate for these types of policies because they're so directly impacted. I think that sometimes certainly it's a cost thing. It sounds very expensive. It does require budgeting and planning and foresight and playing out all the hypothetical what-if scenarios. But I had 3 women, so my company is 20 people, so we're a teeny little company, and I had 3 women back to back to back go on leave, October, November, December. I had people have babies. And so for a 20-person company to be down 3 people, and we were able to figure it out, and we still had good profit margin, and everybody still got their holiday bonuses. So from the financial aspect, it can be done. I think it's more so a lack of awareness and education about why it's so important, the benefits for both new moms and new dads to be home with their kids. I think there's an education gap that needs to be solved. And I think if people really understand the benefits from both the business aspect and the family aspect, I think you'll see more companies adopt leave. I think that as we get more women in leadership roles, that will accelerate.
Yeah, and the U.S., I mean, our policy it really stands out in the world as being bad. While I was pregnant, my husband and I took a trip to Canada, and we were in a restaurant, and I was visibly very pregnant, and our server that evening, she was also pregnant, and so we started talking about all things heartburn and all kinds of wonderful pregnancy symptoms. And eventually, I asked her about her paid leave, and in Canada, you get 52 weeks of paid leave. 52 weeks of paid leave. Now, the first 17 are just the mother. And then the remaining 52 minus 17 are split between both partners, both parents. So if you want, the woman can take 52 weeks. If you want, both daddy and or mom and partner can take 17 weeks, and then one of them can add on the rest, right? Like you can do it kind of in any, you can jigsaw puzzle it. I mean, I think the lowest standard in Europe would be like 18 weeks. So we really are behind the times. But I think that Americans don't necessarily care what Canada and Europe do, right? Like we don't see that as the barometer. I think Canada's economy is doing pretty well, but for some reason we think that if we adopt those policies, we're all socialists or something. So when California passed theirs, there was a lot of opposition from business groups and from chambers of commerce, and now those businesses will say, it actually worked well for us. It's been great. It's been fine. And so, there is this fear and kind of like the American blinders we put on sometimes that influences the public. And honestly, so Hillary Clinton was the first presidential candidate to ever mention paid family leave on a debate stage, ever. And it was in her opening of her first debate, I noticed. And
I was at home and I cheered.
Yeah,
I was like, oh my gosh, that's a huge moment.
Yeah, but I think that's great that she did that. But I also think that because we're so divided right now, like the minute she did that, now this is a political issue, right? Instead of a family issue, and that is a really, I think, just really difficult reality of American democracy right now.
Yeah, I think at some point, hopefully, we stop seeing these things as women's issues and see them as like people issues or family issues or business issues. But I think you're right. I think because it gets lumped in as like a women's issue, it gets downplayed, and there are high-powered lobbying groups that lobby against it. And that does a disservice to everybody. So it would probably be good if we all realized it's not just a women's issue.
So that leads me to my next question, Rich. What is the feedback that you hear from men? So you said with your workforce, a lot of them are men who would potentially be taking the leave. Do you see that they are taking the leave, and what's their feedback? And also, have there been male advocates who have championed this issue?
I'll say real quickly about the men who can utilize it. I've gotten personal notes from new dads in our workforce who have said, thank you, like this is my second child, and this time I actually get to spend some time. And that is a really gratifying kind of note to get. And we love it. And we will be coming up on a full year of implementation here in the spring or summer. So we will have sort of more data to look at, but the personal stories are pretty incredible.
I think that we have more women than men that work in our company, but we have some men, and I think that they appreciate so much the fact that it's available to them if and when they decide they want to take it. I'm on the board of the Women's Fund. I'm a new women commissioner. So I talk a lot about these quote unquote women's issues. And I talk a lot about equal pay. And I think the flip side of that is if we believe in equal pay for women, we should also believe in equal benefits for dads. And I think that the men who work for me appreciate that I'm not just advocating for equal benefits for women or equal pay for women, that I'm also talking about equality in general. It's not just a women's issue, it's an equality issue.
And studies show that there are actually increased rates of educational attainment and self-esteem and things like that among kids whose dads have been able to take paternity leave. So I think those studies are in other countries because we have no paternity leave here. But it is interesting. It's that bonding that happens early in life is incredibly important.
I have another one. So it's been mentioned that current workplace policies, and we've talked a lot about this, are not relevant to modern day families. So can you explain why you think this is and what policy changes need to happen in the next decade so that they are relevant? So your wish list, in addition to paid leave for mothers and fathers and also for caregivers of aging family members, what do you think is within this next decade that we need to make happen?
So to answer the first part, the workplace policies are not reflective of the current reality of today's families. The workplace policies that we are living under or living with still are policies that were created, in the 40s, 50s, 60s when women stayed home and the man went to work and it was, mom, dad, 2 kids, and a white picket fence, and that was the workplace policy. That's just not the reality of the world that we all live in anymore, and policies have not kept up. And I think that's why you're seeing some of this now, is because as family dynamics are changing, as more women are in the workforce, you need policies to keep up with that. I think so this is one that I don't think will take a decade to get there, but I think there's a need, and I think New York outlawed this. The county auditor here, I think, also recently just said they were going to stop doing it, but stop asking what is your previous salary. Ask what you want to make. Ask, okay, coming into this next role, what do you want to make? Certainly there needs to be some level setting of what is your salary expectation, but I think stop asking what you made at your last role is an important one.
Because it affects salary negotiation, mainly for women in negotiating in your
Yep, yes, exactly. So I think that's a big one. I think we'll start to see more around workplace flexibility. I think that's also a big one. I think the way technology has changed the dynamics of the workplace. A lot of us don't have jobs anymore where we have to be at our desk from 9 to 5. We can be accessible from a lot of different places. Work can happen early, work can happen late. There's a lot of time shifting that's going on in our jobs. I think that having that type of flexibility also is better for women and supports more women in the workforce. So I think that's one that companies are still sort of trying to experiment with and struggling to figure out exactly how to make it work within their culture or within their dynamics. But I think that's another one that we'll see more companies looking at over the next few years.
I totally agree with all those. A couple that I'd add, I think we need to strengthen our minimum wage policies. So here in Ohio, our minimum wage is slightly above the federal, and it actually has an automatic increase each year to try to keep up with cost of living. I'm glad that we have that increase because federally that's a morass. But even the Ohio minimum wage is absolutely not a living wage. It's, I believe, $8.15 as of this year. And within that, we have what's called tipped minimum wage, which is a fairly self-explanatory title. I probably don't need to explain it, right? It's what tipped workers have to make. And it is, does anyone want to guess what it is? Yeah, it's $2.25 or $2.50, yeah. It's insane, right? Okay, so if you make $2.25 or $2.50, if you make the tip minimum wage and you don't get enough tips to supplement you up to the minimum wage, then your employer does have to supplement you up to that. And so you are not going to go home at the end of the day, hopefully, making only $2.50 an hour. Problem is, it's hard to enforce that, honestly, from there are a lot of wage abuses in this country every single day with low-wage workers, and government is not equipped to enforce all of them, and that's why these abuses persist. And typically, there are people that happen to people who cannot advocate for themselves as well, because they're working 60 hours a week to try to support their family because they have terrible low-paying jobs, right? So vicious cycle. So I think we need to see a lot of updates to our minimum wage laws. Another thing about tipped minimum wage is workplace harassment. There's been a lot of talk now about highlighting sexual harassment in all kinds of spheres, including in the workplace. And I'm very appreciative for the women who have the microphones to be able to do that. But the rates of sexual harassment are worse in lower paying jobs, and tipped workers are absolutely one of the first targets of sexual harassment because they make lower wages. Bosses, usually a lot of times, like also middle manager bosses, not necessarily running the company, but they're one level above, and it's just they're more vulnerable to it. And then customers are also, no matter what I do to you, you have to treat me nice when you bring me my burger, or otherwise you're not going to give a good tip, right? It's a really effed up, excuse my language, I'm sorry, power dynamic. And some progressive restaurants, I went to a restaurant in New York recently that had completely done away with tipping and didn't allow it, didn't accept it, didn't have it on your receipt. It wasn't like, we don't accept tipping, but feel free to put it on there. It was, so we need some more wage protections and to strengthen our minimum wage laws. And then we have just a host of challenges we're going to have to confront in a gig economy where more and more people are making their living as contract workers, and therefore, we have a healthcare system that's based on an employment relationship in many ways, not solely now, but in many ways it is. And a lot of workplace safeguards are again based on an employment relationship and not on a contracting relationship. So we've got to confront the way our workforce is changing, and in the next 10 years, I think that conversation is going to come to a fever pitch.
You had mentioned sort of some sexual harassment, but it also leads me to think about, do you feel that women are, and I'm assuming this is probably a yes, but do you think that there's some fear from women in asking for or requesting paid leave and with their employers, in fear of that it would hurt them in their job, asking for that time off, or even advocating for it?
I mean, you hear about like the mommy track, right? And that if people ask for that time off, all of a sudden they're kind of kicked over onto this other track, and they don't get as many opportunities as their coworkers, or they're not thought of as the next up for the promotion. And so it needs to be something that is readily available, and that you're not shamed for taking it, or that you're not judged for taking it.
Yeah, absolutely.
So any other thoughts do you guys have any other last thoughts that you'd like to share? No,
Thanks
really
for having
yeah,
us.
appreciate it. Appreciate it. Thank you all very much for being here today. Thank you.